Hello, my name is Stephanie, and today I will be performing the vital sign skills video. For supplies, I have my stethoscope, I have my blood pressure cuff, and the watch. So I will start off by performing hand hygiene, and I will close the door to ensure patient privacy. And this is my patient. Can you please confirm your first name, last name, and date of birth? So today I'll start off by assessing the pulse rate, followed by the respiration rate, and then I will finish with the blood pressure check. So to check the pulse rate, I'll use my index finger, my middle finger, and I will place it over the radial artery. So I will first locate the radial artery. All right, so I located it. Once I've located the artery, I will assess the rate and the rhythm. And they seem to be, they're both normal. So what I will do now is I will count the pulse, count for 30 seconds. All right, so the pulse is 32. So what I will do now is I will multiply 32 by 2, which is 64. And that will be the total pulse rate that I have for this patient. And that falls within the normal range of 60 to 100 for my patient's age group. So now I will perform the next step. If I can please borrow your wrist here, place it over your chest. All right, so I went ahead and counted for 30 seconds, and the respiration, breaths per minute, was 9. So now what I'll do is I'll multiply that by 2 to get 18, and that falls within the normal range of 12 to 20 breaths per minute for a patient in his age range. And while I did that, I also assessed the chest wall, and I noticed that the breathing was normal. It is not shallow and it is not deep. So again, his respiration rate is normal. So the third step that I will do is I will check his blood pressure. I will start off by locating the brachial artery. So I located the brachial artery. I will place the blood pressure cuff 1 inch above the inner elbow area. Since I'm using the left arm, I will place the left arm arrow over here to the left. And my patient's usual blood pressure falls within 120 to 80 diastolic. If you can please hold this for me. So since it's 120, I will go ahead and add 30 millimeters of mercury to 120. So that'll add up to 150 systolic rate. So 150 is what I will pump the the blood pressure cuff up to. I will place the diaphragm on the area without touching the cuff or the tubing. All right, so the blood pressure that I got was 120 over 70, and that's within the normal blood pressure range for a patient his age. And I waited 10 to 20 millimeters of mercury after the last Korokov sound, just to make sure that indeed what I listened to was the last sound. All right, so I will go ahead and perform hand hygiene. And do you have any questions for me?
No.
All right, thank you so much.